Well, let's look at this torso model, and brought to you by Curious Ramran. What we want to do is look at the model and identify arteries and veins. Now, I did another video where I went through, and you're going to see some of the same pictures, and I went through and I looked at just cartoon pictures or drawings, and we looked at the arteries and the veins. I did the arteries first and then veins. This time, we're going to actually start, and we're going to start with the pulmonary, and not spend too much because I have other videos on that, and we're going to work our way up, and then we're going to work our way down, and go superior to inferior, and we'll talk about some of these blood vessels. And I want this to be a good guide for my students who are going to be taking the practical, where they've got to identify vessels, those both around the heart. I think we know that, but what about these other vessels, like these vessels running up here and here? So I'm going to have to pause the video at various points so that we can see. And I'm going to start by, let's get rid of the lung. Let's actually just the superficial part. And let's look in here. All right, we got branches and tubes coming together and branches coming apart. And what I mean by that is the word bifurcate and venous return, or phrase venous return. Associate with arteries. Remember, arteries are large and get smaller as they branch out, and we use the word bifurcate, and the blood's being supplied. Associate supplying blood versus draining or collecting, and the vessels are going to get larger. This is kind of a good thing to follow, and unlike my other video, I did all arteries and all veins. Now I'm going to do both of them at the same time. So let's start with the major artery that we call the aorta, and what branches off. We got the brachiocephalic, the left parotid, and then the left subclavian. And it's going to be hard to see the subclavian in the model, but I'll point that out to you, and I'm going to have to reposition a couple times. So here we are. Let's go ahead and rip the heart out. And if you first notice, you have your brachiocephalic, your left your left carotid, I almost said coronary and had one. Your left carotid, and then your left subclavian. So, okay, so let's see if we can see. This subclavian actually is right here, and then coming off the right subclavian, so this is going to branch up. You have the carotid. So here's the common carotid, and here's the right subclavian. How do we know it's the subclavian? Well, think about the clavicle. Subclavian is underneath the clavicle bone, right? Sub, below. So there's the, and now what is going to happen with this? This part you won't be able to see in the model. You won't see the supply going down the arms because, well, we don't have an arm here. So let's work our way up. Let's go with Old Familiar. Okay, this aortic arch, as we see the first three vessels coming off, then you have the descending, which this is going to go here. And actually, I'm going to take the trachea, lift it up, so now we can see the descending aorta. Now it's in this cavity, so we also call it the thoracic aorta. Coming off the heart are going to be, let's follow the trunk, moving here. So here's your right and left, okay, right and left. This is the right pulmonary artery. Now returning to the heart is going to be your right, and then here's your left side, your right and left, superior and inferior pulmonary veins. Okay, so I'm going to move the heart over here, and let's work up, then we'll come back. And I'm going to reposition this in a second. So let's look at, right, so here's your common carotid. There's your common carotid. Right? Common carotid. Follow the common carotid. Branching off it will be the internal. It's going to be deep. Now, don't confuse internal carotid and the internal jugular. They both are doing similar things. They're going to be supplying blood to the brain or returning blood from the deep brain. But the location, all right? And what I mean is, see this right here, that's the internal jugular. All right, so I want to show both pictures, and then, so the internal jugular, if you follow the blood going into here, I said follow, you should say the blood is draining, right? Remember, these are smaller vessels that get larger, ultimately finishing with the brachiocephalic and then the vena cava. Let's point that out one more time on the model. And this is one that students actually get wrong all the time. I've seen students confuse the pulmonary trunk with this. This is the brachiocephalic. This is the brachiocephalic. All right, now here's the subclavian vein. The internal jugular is draining down here. These two combine. Now you have brachiocephalic, and then you have the superior vena cava. There's the inferior. So we'll get to that in a moment. And hopefully this video won't go too long. I might have to break it into two parts. So there's our internal jugular. And so that's pretty much everything we can cover with the head and neck. And I think we need to get down to the abdominal cavity. And let's just make sure we can see everything here. And let's focus. Now we're going to go ahead and take the heart out. And I'm going to go ahead and move this around. So let me just pause for a second. Okay, I've switched the camera so you can see. So here's the heart. This right here is the diaphragm, and this is the inferior vena cava. You see the thoracic now. Once it goes down through there, it's going to be into the abdominal. So I want to reposition this. I'm just going to move it like this, and there we go. All right. So I want to take the liver out. Inferior vena cava going up that way, and here it is here. Now I want to finish with the hepatic portal, but while I'm here, I'm going to go ahead and point out this is the hepatic portal vein. This is the hepatic portal vein. So let's get the stomach. Okay, there's the mesenteric veins, the superior and inferior. If you see here, these are all arteries. What you don't see is the veins. The inferior one is going to supply the large intestine, collect from the large intestine, and then the small intestines are going to be the superior mesenteric vein. Now, let's keep taking out our torso model. All right, there we go. We got some big ones here. When I say big, these big ones. This is now the abdominal aorta, and this is, of course, the vena cava. All right, working its way up. But what you can't see is the hepatic portal system, and you can't see some of these other vessels. So I'm going to just pause for a second, and I'm going to talk about this, and then we'll come back to the blood going back to the liver and ultimately to the heart through the inferior vena cava. So let's look at the gastric and the splenic artery and the common hepatic artery. In order to have that, you can't really. You're not really going to see. You're going to see the gastric artery, but let's look at the splenic. So here's the spleen. All right. So here's your spleen, and that's the splenic artery. And I already pointed out the hepatic vein. All right. Now, when it's actually here, the hepatic portal vein, you also have the hepatic artery. All right. So these are going to be the renal going to the kidneys. So these are the renal vein, renal arteries. All right. And I've got a kind of a mess going on here. And let's run down here and let's look at the vessels that are coming here. And I think I probably should position this a little bit better. All right, we've repositioned this so that we can follow. All right, so if you look here, that's actually the pelvic bone, the iliac bone. So this is the vena cava. This is going to be the common iliac. Once it's broken, not broken, it's going to running into there. All right. Common iliac, vein, artery. Once we're here, it's the femoral. So here's the femoral artery, femoral vein. And you'll notice that there's that running down here is the deep femoral vein, deep femoral artery. And what if you go down further, you'll actually, we can't see the saphenous vein per se, but you'll see it right around here. This vessel, if it went down, that would be the saphenous vein, and then this is a continuation of the femoral as we get further down. I think I pointed out the renal artery, renal veins here. So renal, that goes with the spleen. All right, so I'm just going to do one more position. So I mentioned the hepatic portal system, so pause the video and take a quick look at this. One of the benefit of seeing these models is, you remember, you got digestion that's going on here, the absorption, and here's the supply, but what you don't see is if you overlaid the blood vessels, that's one thing we're missing with the torso model. So, what I want to show you is this is from a different torso model. These would be all these blood vessels, and these are of course, the blue, even though blood's not blue. All this is going to be filtering in, going to the hepatic portal vein. Okay, all right, it's going to the hepatic portal vein, and that's, again, you're talking about things from the stomach, small intestines, pancreas. They're all running in here, hepatic portal vein, and then you got the hepatic veins. The hepatic veins are in here, and ultimately they're going to feed into or run into the inferior vena cava. All right, so that's pretty much it, start to finish. All right, thanks for watching. So I need to do a quick correction to the previous portion of the video, and I'll probably upload this separately or combine it for the last one, depending on time. So I talked about the common iliac artery and vein, and I refer to part of it as the femoral. So let's go ahead and clarify and point out the femoral artery and vein, and point out the saphenous vein. In the video, first, remember, arteries are going to bifurcate. So here's your abdominal. This is your abdominal aorta. Your abdominal aorta. And it's going to bifurcate into the common iliac. Now, the common iliac is going to run here. At this point, you're going to see the external and internal. So it's like 1, 2. The internal bifurcates and runs down and goes deep, supplying the blood supply here. And this is going to continue. This is going to continue. And the good part about making that mistake is I didn't make the mistake in class, so my students have already heard this, so I'm just going to clarify for the video purpose. Now, this is the internal iliac vein. External, they run into the, of course, the vena cava, which this is the, all right, so this is the inferior running all the way up. So if that's the case, what actually is the femoral? In the video I pointed out, I said this is the femoral, but that's a mistake. Here's your iliac bone, a good frame of reference. Then you have another frame of reference, which is, think about where the femur is. The femur is in this area, right, the head. So you can't have a femoral artery if you don't have a femoral bone. So the best way to remember this is the femoral artery, this is the femoral vein. Now the last thing to point out is the saphenous. And usually I'll point down here. This is the saphenous. What you don't see is the femoral vein is actually going down deeper. The saphenous is going to be here, and it's going to run towards the midline. It's going to run in this direction, and then the vein will go deeper. You'll have the deep femoral vein. So that's just a quick little correction. So again, this is the best way. If I'm pointing out a model, I would point to the artery here and the artery vein here for femoral, and I would point down here for the saphenous. All right, that's just a quick little correction, and thanks for watching.